My greatest strengths as an instructor are my clinical background, research interests, and how I see my role as an instructor. My clinical background as a psychiatric mental health nurse practitioner whose focus has been in geriatrics is rare, or so I've been told. This clinical experience affords me the opportunity to share with my students real world scenarios and case studies to foster their learning. My research interests are on a more global scale, are related to improving health disparities and making research more culturally relevant for underrepresented groups, especially African American participants. Lastly, how I see my role as an instructor is important. There are a few African American women tenure track faculty. I want to be an example for other underrepresented groups as a mentor and a resource. I also see my role as helping students to use their own life experiences to become better nurses, nurse practitioners, midwives, nurse educators, and nurse leaders, and so on and so on. I do not see students as blank slates, but rather as unique individuals who can shape the healthcare system for the better.
I would say I have three strengths that make me a strong candidate as an instructor, or what I'm actually pursuing is a tenure track faculty position. And I'm currently in that process right now. But my three strengths are my research background, my research interests, rather, my clinical background, and my lived experience. So, with my research interests, the broad overarching theme of my research is to decrease health disparities, specifically with African American persons living with dementia and their families and family caregivers. And so this is important because as we are seeing more of a push, and I hope we continue to see this push towards health equity and social justice, the ability to use my research as an example in the classroom with a health disparities course, or even helping to weave social justice and helping to weave social justice and health equity throughout courses. I think my research and the lens in which I see research and the lens that I focus on would be helpful in that aspect. My second strength is my clinical background. And so most of my clinical background is in geriatric psychiatry, which is, so I'm told, a rare encounter for a nurse or a nurse practitioner. And so I would love the ability to use real examples from my clinic, of course, maintaining confidentiality, to share case studies and real life challenges and experiences that I've had in the clinical setting and move that over into the classroom. And then my last strength is my lived experience as an African American or Black woman, female, from a lower socioeconomic background. I understand the some of the nuances around having multiple minority identities, also known as intersectionality. And I'm quite comfortable with having conversations as an underrepresented minority with other underrepresented minorities, or to the large, more majority group. And I think that's important because we want a nursing workforce that reflects the clients and the patients that we're going to take care of. And we need faculty who are comfortable with having what we sometimes call those difficult conversations and creating a safe space for students. Thank you.